Welcome to Medical Matters Weekly with Dr. Trey Dobson, presented by Southwestern Vermont Healthcare and Catamount Access Television.
Welcome, everyone. Today is August 15th, 2022, and I believe we are recording this show for an August 17th episode. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency physician with Dartmouth Health, and this is Medical Matters Weekly. It's a show about the aspects of healthcare that matter to you most. My guest today is Kris Perry. She is a social worker, child advocate, and the director of the Institute of Digital Media and Child Development. Kris, did I get that title right?
You did.
Thank you so much for joining us today.
Great. I'm glad to be here.
A little bit about Kris, bachelor's in sociology and psychology from the University of California at Santa Cruz. Kris, I was just actually in California last week, so I have the geography sort of memorized a bit. Received her master's in social work from San Francisco State University and many other things. Worked in child protective services for the, am I going to mispronounce this, Alameda County Social Services Agency. Advised California Governor Gavin Newsom as Deputy Secretary of California Health and Human Services Agency, and author of Love on Trial, about her and her wife's fight for the right to marry. So, Kris, first off, thank you again. And where are you right this moment?
I'm sitting in Berkeley, California right this moment.
Berkeley, that is so great. So tell us a little bit about, your background, where you're from, and how you got into social work, and please ad lib with that.
Well, thank you so much for the question and for having me as a guest today. And I'm really excited to tell you a little bit about my journey through psychology and social work and child development. Actually, it started out when my parents were in their early 20s. They were in the suburbs of Chicago, and they had this dream of moving to California. In fact, my father inherited a small amount of money and decided that maybe if he opened the first McDonald's in the Central Valley of California, that he could make it big. And so he put my mom and I in a Volkswagen, and they drove to California, to the Central Valley, and settled there. And I grew up there. Even though I wasn't born in California, I've been here almost my entire life. And I grew up in the Central Valley, which is a very specific part of California. It's more rural and agricultural, and there quite a bit of oil is processed there, and ranching. And the politics are a little different than on the coastal side of California. So my parents were sort of Chicago residents in this new place called California. And I got to grow up sort of with the benefit of all of their experience from the Midwest, but also living in this really new up and coming part of California. And I loved it. And I had a great childhood there. But since then, I've moved to Northern California and spent almost my entire adult life in Northern California, whether the Bay Area or a little south of here.
And you painted a picture. I mean, it almost sounds like a movie. I can't wait to see the movie that you create after this, getting in the car and heading to California, almost like a John Steinbeck novel. So yeah. What led you to pursue social work?
Well, I was really fortunate as I grew up to know my parents' friends and see them actually teaching. They were both public educators in different parts of Bakersfield, where I grew up. My mom taught first grade for 20 years, so she taught children to read every year, almost my entire childhood. And the best day of my year was to get to go with her for a day and help her in the classroom. I actually couldn't wait for that day. And my father at the same time was a dean and a vice principal and a superintendent in the more rural part of Bakersfield, where Delano and McFarland, where Cesar Chavez was busy leading farm workers to protest some of the working conditions there, and sort of leading a movement to create a better life for their kids and the families that were working in the fields. So I spent my childhood watching them work in communities where children really didn't have access to high quality healthcare or education or housing or food. And it really made a big impact on me. So when I got to college in Santa Cruz, I immediately was drawn to the social sciences. I wasn't sure why, but I just really wanted to learn more about psychology and human development and sociology. And eventually I realized that those were important areas of study, but to really be active in sociology, you have to become a social worker. And so I knew I needed to go on to social work school so that I could apply all of the theory and the research that I had learned in college, in real life, in real communities that were still struggling like the one I had grown up in.
And you went into Child Protective Services early in your career. First off, just for our audience, which, by the way, I didn't explain this to you, Kris, our audience is, has healthcare professionals, non-healthcare professionals, community members, you name it. And so I like to sort of standardize our understanding of the topic. And for Child Protective Services, what exactly is Child Protective Services? How would you describe it to someone?
Such a great question. In California, there is a court system. In the superior courts, there are family courts that look at how children are doing in families. And there are laws that protect children from abuse and neglect. When the government, someone like me would go out and assess a child's safety, if we determined that they weren't safe in the home, we would write a report, we would submit it to the court, and they might ask the family to come into the court and intervene, mostly in ways that didn't disrupt the family completely. In other words, didn't remove the child from the family. They would make orders for parents to seek treatment or join a program or move in with a grandparent or something along those lines to preserve the family. But there were many, many cases at that point in time. This is the early, mid to late 80s, early 90s. And as you'll recall, we were battling an HIV crisis, a cocaine, crack epidemic. Families in the east part of San Francisco Bay Area were really suffering from these epidemics, and children were increasingly suffering from poverty and a lack of access to secure housing, secure food, and even the ability to get to school. So many of the reports we were writing at that time, and what child protection really is trying to determine where children are not protected and need additional intervention. Sometimes they're removed, sometimes they were put in foster care, but then immediately a plan would be put in place to reunite them with their families. But it made such an impression on me that these bigger economic and health crises were causing individual families to break apart, and children were being put in strangers' homes and left there for months, if not years, waiting to reunite with their families because their families couldn't build up enough of the resources they need to reunite with them.
And like you said, that must have been, as you're telling these stories, must have been incredibly impactful and probably shape what you do today professionally.
I live every day with a sense of the importance of protecting children. It started in the streets of Oakland and Berkeley and driving up to homes and going inside and meeting with families and trying to figure out what we could do to protect the children there. Because no matter how much parents were suffering from these external influences, right, these social determinants of health, they always wanted the best for their children. Without a doubt, they always wanted that and would make really selfless choices, allow the child to live with a relative or go into foster care briefly. And there were really painful moments. And I still feel the presence of those families in my career as like the people who really had to make some of the hardest choices. And yet children continue to be unprotected in other settings, not just families. We see what's happening in schools today, the increase of school shootings and the kinds of bullying and other problems that can happen to children at school. And now with digital media, which I know we're going to get to in more detail in a minute, seems to be another frontier of where we haven't really thought enough about how to protect children from harm. And they are being harmed. And so I really feel drawn to this new area of child protection.
Yeah, it's wonderful. I mean, this is a little bit of my naivety here, but I think about before digital media, our gaps often were between the school time and the time at home and the parents' time, or at least that was one of the gaps. And I know there's a lot of efforts working on trying to make sure that time was supportive and that the environments were supportive for kids, especially in the inner city. And now it's kind of shifted towards digital media. So why don't you tell us a little bit about the Institute of Digital Media and Child Development? We'd love to hear about it.
Yeah, well, I'm really excited to be here. I'm just starting my 4th month. The Institute was founded almost 10 years ago in 2013 as a research and education nonprofit that really wanted to examine digital media's impacts on children and adolescents. And the Institute's mission is really to advance and support interdisciplinary research, inform and educate the public, advocate for sound public policy for health and wellness, and enhance human capital in the field. So the Institute accomplishes this by funding novel, objective scientific research, by interdisciplinary teams of experts, convening conferences and research retreats, publishing in leading journals, and developing human capital, again, in the field. It also really endeavors to educate and inform the public through media. We use workshops and panels. We look at, the media and who the trusted resources are out there, and how to get policymakers to pay attention to the experts, and how to help them understand the evidence base, the research that really is the underpinning of the work at the Institute.
Yeah, I certainly remember the at least the media coverage about a year ago on the concerns of parents who work in Silicon Valley, and the effects of what they do, what they make, what they create on their own children, which was just a fascinating read. But it was actually just a blip. It was gone and moved out of the public's face. And so, the Institute of Digital Media and Child Development, that's really where the funding and the support for the research that's so necessary, I think, is going to come from, as well as other initiatives. So we appreciate it. I'm going to ask a silly open-ended question that could go for hours, but what should parents know about media use for their young children?
Well, this is an area of great interest to all of us, because once we learn that there really might be a problem, that digital media might not be always a good thing for children, we immediately want to know, well, so what do we do about it? But unfortunately, there's really no black and white answer to that question. We don't want to say that screens are all good or all bad, but we do feel like it's pretty easy to emphatically say that less is more, especially with young children. The American Academy of Pediatrics, the AAP, and the World Health Organization have established some basic screen time recommendations for children under 5, which is nice, which is that no screen media for children under 18 months is ideal, with the exception of occasionally video chatting with a family member. And when children are between 2 and 5, they shouldn't be on a screen more than 1 hour a day, hopefully less. So unfortunately, we know that there is harm being caused by digital media and too much use of it, but recommendations really haven't been released yet for children over the age of 5. And why that's even more of concern is that since the pandemic, we know children are using screens more than they ever have before. In fact, children are averaging like 53 minutes of screen time a day by the time they're a year old. And that just really kicked off, in earnest in 2019 because of the pandemic. And that number has climbed up to 150 minutes for children who are 3 years old a day. And the screen time across all ages during the pandemic has increased dramatically. In the case of, adolescents and teens, and in some cases 7, 8, 9 hours a day. So what we really hope, just a basic recommendation, is less is more, especially in very young children, but even in your older children, everything you can do to minimize the amount of time they're on screens, the better.
Also just sort of going off on the tangent here, I have my own anecdotal concerns of what excessive screen time does for children, and frankly anyone, but for developing minds. And just saying some of those are very obvious ones. My concern that especially adolescents that are using too much screen time may have trouble concentrating when they need to do long periods of reading or studying or writing, which are so essential as they enter college and the job market. And I see kids who almost, they put their phone down, they start something, but it doesn't last for sometimes a minute or two before they have to pick their phone up again. And it's like any vice, it can be detrimental. But I would be less interested in my anecdotal observations that have no scientific basis, and more interested in what some of the research is showing. Can you comment on any of the research?
Well, your anecdote, I find, is just spot on. Every parent, my children are grown now, but every parent I talk to with children at home still has the very same anecdote. So there's something going on here. There's some universal concern based on how we see children impacted by their use of screens. And that's backed up by the research, which has shown us on multiple fronts whether it's the physical health of the child, in other words, their eyes, their backs, their weight, even the respiration and their tendinitis. These things have started to be on the increase. We also know mental health wise, children are struggling and suffering from more depression and anxiety than they were before. And they report that it is worse when they're online or on screens than when they're not. So these anecdotes are backed up by lots of evidence that show that, in fact, children really are struggling to cope with what it feels like to be on screens. And there are more, ideas for how to manage the child's screen time to cut down on some of those negative impacts. But each child's different. So you want to individualize this plan with your child. If they're old enough to work with you on a plan, a family media plan, then you could start all members of the family trying to change your behavior around screens. So in other words, we only want to use our screens in the afternoons after homework is over. We never want to use our screens at the dinner table. We always want to put our screens away an hour before bedtime, so that you're starting to put boundaries around screen time so that it isn't all the time. And that cuts down on some of those negative impacts I just described. But all in all, these are really like opportunities for communication and co-engagement, and for the parent to provide the oversight that they have to provide, not unlike some of the examples I gave earlier about, education or intervening with families that are struggling with harder issues. The parent really is in charge and has to exert some of that control over the child's use of screens to ensure that it's balanced and that they're happy and their sleep isn't disrupted and they're not becoming anxious or depressed.
Kris, I love that description. And, I think first off, awareness, that's the first thing. That's the big battle in a family. It's awareness. And then trying to lessen some of the defensiveness, not only from the children, but from the parents as well. And then you talked about individualizing it. And I think that is so important. Certainly, there's probably a wrong way to go about it, but the right way to go about it varies depending on the child and the circumstance and the parents. I know personally, I've seen and been a part of trying to get children to decrease the amount of screen time, but then I'm using mine, and my excuse is, well, mine's for work. Mine's for work, so that's more important, and that's not true. And one of the better things I've done over the past month is remove my email from my phone. People still get around it through text messaging, so I have to work on that. And again, is diminishing that defensiveness and saying, okay, we know what's happened in the past. How do we get that better in the future? And boy, I hope there's some good answers, because it actually causes me a little bit anxiety as I see adolescents moving into college and worry that their ability to do some of to retain information by reading in other venues is going to be really suffered. On the flip, like you said, also, you did mention that you don't want to say screens are all bad. I will say some of the children that I'm in contact with actually do absorb quite a bit of the good information that they learn through media. And so we want to promote that and not just make it all so negative. The problem is, if you make it all negative, they start feeling guilty, shameful, they start hiding it. That's the classic example of addiction to any type of work or substance. And that's what we want to avoid. So, I don't know why I'm talking about this so much. It's because it's not my area of expertise, it's yours, and it just shows how much anxiety I think it causes all of us as parents. So let's move on to, you've been a part of some really big legislation in California. Tell us first about what you were able to accomplish for children in the state.
Well, I'd love to back up and just, validate what you just said about, your own behavior, your own tendencies around social media and digital media and screens, and understanding what it's like to be a child and have these powerful devices with so much capacity for communication, but also, other things that may or may not be good for them. I think it's that place of empathy and understanding that is a great jumping off spot for a parent to have a conversation with a child about what can we do as a family to feel better. We all want to, a great example of taking one of the apps off your phone and just saying, I'm not going to use this device for this. Those kinds of boundaries, creative solutions. Again, it's individual families and individual kids. So I love that example. So thanks for that. And in California, we know California is home to Silicon Valley. it's headquarters for Twitter, Facebook, Meta, Google, and so it's not surprising that the California legislature, the California governor, and others have really been trying to focus on child well-being in relationship to digital media and screens. So there have been some recent bills introduced to increase children's privacy, to protect children from algorithmic addiction and other persuasive technologies. And those are all pending. We don't know how they'll turn out yet, but it's interesting to see a state like California try to put some balance and controls in place. In addition to that, in California, it's been wonderful to watch Governor Newsom and leaders in the education and healthcare fields really double down since the pandemic on a number of universal programs, universal healthcare, universal pre-K, the expansion of paid family leave and child savings accounts, as well as the expansion of home visits, kind of like I described earlier in my early career doing with families to try to prevent things getting worse than they might have already been. So California has really been at the forefront of investing in children and families for the last several years. And one of the reasons I got involved in state advocacy and politics and policy was around the year 2000, Rob Reiner, who your listeners may know from being a movie director and an actor, led an effort here in the year 1998. We taxed tobacco in California, and that has raised hundreds and hundreds of millions of dollars just for children birth to 5. And that investment in young children has done so much to expand the services I just described to you and has led others to try and do more. So we're just really fortunate here in California to have those services.
Absolutely. So you were also the lead plaintiff in California's suit for marriage equality. So we would love to, especially here in Vermont, we would love to hear about your experiences there.
Well, Vermont has a wonderful history on this issue. And if I recall correctly, it might be the state where the first legal same-sex marriage was held, or that might have been Massachusetts, but Vermont was not far behind. But in California, not far behind. California had a long sort of history of trying to get same-sex marriage legalized through the courts. And it had happened in 2008, right before that presidential election. And only a few minutes after it had passed through the California Supreme Court, a group of proponents who really did not agree with that policy put together a ballot measure, and they put it on the ballot, the same ballot that Obama was on. And in fact, it passed. In other words, they struck down marriage equality in California at the ballot box. And that led to my now wife and I getting engaged in a lawsuit to sue the state of California over that a fundamental right being taken away from us. We were not yet married. We had hoped to be married soon, but we couldn't be. And that case that we filed led to the one and only trial of a same-sex marriage case in the country, in the world. And that later got all the way to the United States Supreme Court because the proponents appealed. Every time they lost, they've appealed, and we got to the Supreme Court, and we won the United States Supreme Court in 2013. So California, we brought back marriage equality in 2013, and we're married a couple of days after that.
It's a great story. I bet the audience is saying, wow, they didn't know that background. They didn't know who they were listening to today. And I just want to say thank you on behalf of so many people.
Yeah, thank you.
So do you see a connection between marriage equality and child advocacy?
Absolutely. For me, growing up in this part of California that I've described, kind of conservative and rural and a little bit remote, and knowing I was different. And I was different because the law said I was. I knew I was a second-class citizen as a young child, knowing that I was probably gay, that I would never be married, and that everyone would know that about me as soon as I said I was gay. And I felt badly about that. It made me feel badly about myself, and it changed. I really believe it sort of changed the whole trajectory of my life, not knowing that I was equal to everyone else. And as I got older and I thought maybe there was something I could do about that, I became more empowered and I felt stronger in my convictions about that. But when I think about the children growing up in California today, there are lots of laws that tell kids they're not as good as, or dictate that they can't have things other kids can have. We have an unequal public education system. It's good in some places, it's not good in others. We have an unequal healthcare system. It's good in some places, it's not good in some places. And I really see that the more fair and the more level the playing field is for kids, the better the chances are that they're going to have great life outcomes. So the more we as advocates and government officials and nonprofit leaders can come together to create that level playing field and protect them from harm, the more likely it is they'll reach their full potential. And I feel that was true for me, finally, eventually being married as a much older person. But if I had known that as a child, that I could have that, I think I would have seen my whole life differently. And I think children growing up not in poverty, not behind, not told they're not as good as, would have better outcomes as well.
Yeah, and I have this silly term I've coined called the maturation of society, and that's how fast do we mature as a society to recognize exactly what you just said, that these benefit the children who therefore grow up to be adults and are contributors to society. And, I feel like in the past many years, we've done 3 steps forward, 1 step back. We're sort of in a phase right now where we're doing 3 steps forward, 2 steps back, but I still think we're moving forward, and that's what's so important. As we close up here, Kris, tell us 2 things. What are you looking forward to personally over the next year or 2, and what are you looking forward to professionally?
Well, I'm really excited to be at the Institute and work on this idea that children have a basic right to a happy, healthy childhood, and that it's really exciting to me to be in a position to communicate directly with parents and families again and give them the tools they need to make the best choices for their own children. Really excited about that. And then just on a personal level, I feel like this is an opportunity for me to bring all of the experiences I've had in these different roles over all these many years and apply it to this current situation. And I do believe this is an inflection point, right? We've come through the pandemic. We may or may not have done everything we could do to have protected children during that pandemic. And one of the outcomes has been that they're even more reliant on digital technology than they were before. And we don't necessarily know if the way we're having them use it is the very best way for them to use it. So I'm embarking on this journey with all of you to learn more about the impact of digital media, what is good, what is not good, and how we can collectively make it work for children.
Well, thank you, and thank you from all of the parents who I know have tremendous concerns and anxiety, as we started off discussing earlier in the show. So this is Kris Perry. Thank you for being on the show. It's so much appreciated. I also will thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, Ashley Jowett from Southwestern Vermont Healthcare. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we will see you again next week.